All right, we are back with our third segment here about Endometriosis Awareness Month. Thank you, Andrea, for still being here and sort of diving into some of these topics. My next question for you is really like, how do we get this diagnosed? I know it affects people differently at different ages, and it's very, there's a lot of misconceptions around it and misdiagnosis. So, what if you're feeling some of these symptoms, or if you know somebody who really talks about that, those different pains and side effects, how do we diagnose this?
Sure. It's really important to find a provider, a medical provider, a doctor, a nurse practitioner, whoever you have, that really understands where you're coming from, someone who's truly listening to you. Because a lot of times, and so many of us in the community know about medical gaslighting,
What does
which is
that mean?
basically. Sure. So it's basically when a medical provider, or gaslighting in general, is when somebody sort of brushes off or tries to downplay what you're truly feeling. And after that's done, years and years and years repeating, you almost start to doubt yourself what you're actually feeling. And so you're like, well, maybe I shouldn't speak up about that because people are going to say it's all in my head, and these are things that have been said to me at, 14, 15 years old. Instead of being referred to a specialist who could help me, I was told, oh, it's all in your head. This is residual trauma. Let's get you to a psychiatrist. And therapy is extremely helpful. And I think everyone should, you know, do the inner work. But when it comes to pain that you're telling a doctor that you're feeling, you really want to be believed. And there are doctors out there who will listen to you and believe you and address it head on. And the only way to definitively diagnose endometriosis is through an exploratory surgery, a laparoscopy, where they can go in with very minimal incisions and sort of look inside. They'll be able to sometimes visually see it, take a biopsy, and then send it off to pathology to confirm the presence of endometriosis. What happens after that, again, depends on the provider that you have and the medical team that you are surrounded by. But it can only be confirmed through surgery. There are some forms of endometriosis called deep infiltrating endometriosis, or DIE, that can be seen on certain scans, but that is like very severe endometriosis that can be seen. And, people with stage 1 and 2 endometriosis can be in debilitating pain and have a completely clean ultrasound, MRI, all of that stuff. It can look completely normal when inside there's endometriosis in there. And so really the only way to confirm it definitively is through surgery.
Okay, and so it sounds like there's different stages of
Yeah.
how sort of advanced the disease is, and it
Mhm.
can be missed on ultrasound, CT, MRI, and that's why it goes undiagnosed or misdiagnosed. And I just wanted you to tell me a staggering statistic here about how many years does it take for this misdiagnosis or lack of diagnosis?
So as it stands currently in the United States, unfortunately, it's an average of 7 to 10 years of someone living with these symptoms before receiving a diagnosis.
I
For
got
my
chills, but the bad chills, like there's good chills and
awful.
bad chills. Yeah. And I just was like thinking of you and other people and that lack of support. So yeah, that's wild.
It's absolutely horrible. And it takes into account that misdiagnosis, the medical gaslighting, the not truly being believed. I've known people who have gone to the emergency room just desperate for some help because they're in so much pain, and being sent home told that they're constipated, and that's the problem. When in reality, they're living with all of this pain and there's a reason for it. People just aren't always seeing it. And for myself, it took 11 years to be diagnosed. For my mother, it was 31 years. So imagine living for 31 years with this debilitating pain, trying to have a career, trying to have a family, and being told that, oh, this is just a part of being a human with a uterus. This is just a part of, life, this is normal, when in reality they eventually did find the problem and then they addressed it. But it's so much suffering for so many people, and it doesn't have to be that way. And that's why so many people now are more vocal about it, with the hopes that that 7 to 10 year delay in diagnosis becomes much, much shorter.
Well, and hopefully you're a testament to that. We are getting a little bit better with generational differences between your mom and you. And hopefully, the more, I hate to say, little things like this are getting it out there to try to make this, that you ask that one extra question when you're at the doctor and to speak up for yourself. All right. Thank you so much. We're going to come back tomorrow with sort of what we do now that we are diagnosed. Thank you.
Thank you.